Hello, my geniuses. Welcome to another anatomy lecture series. Today, it's your great science tolerance. I'll be talking about the muscles of the pectoral region. If it's your first time joining us, because we have made so many videos, you can go around our collection, you see any video you want, and if you don't see any video you want, just tell me and I'll make that video solely for you. So if you are new to my channel, make sure to subscribe, press that button now, subscribe, and turn on your post notification button so that when I drop any video, you will sure to see it. But if you want me to make any video for you, just write it down in the comment section. Once I go to it, I'll make that video for you. Or if you have any questions or any way, or you want to support us, just send me a message, and once I see the message, I will reply you. So I'll be making up videos. So any medical student you see that need this video, also send it to them. If you have a brother, a sister, or you are in a school and you want your friends to see it, you can also share it to them, because I would like for it to reach all medical students or those that want to learn anything involving medical science or any science in general, because I'll be making a lot of topics. So if you want it, just tell me. I'll always continue making it, because I just want to sensitize people and increase medical knowledge for many students and those that want to learn. So let us jump right into the video. Welcome everyone to my another video today on the upper limb. I'll be talking about the muscles of the pectoral region. In my last video, we talked about the bones of the upper limb, where I treated all the bones step by step for you to understand, because we will need them in these muscles, because we need them for the origin and incision of all these muscles. So first of all, talking about the muscles of the pectoral region. So where is the pectoral region? The pectoral region is located in the anterior thoracic wall. And where is the anterior thoracic wall? The anterior thoracic wall is in front of the thoracic cage. And where is the thoracic cage? Which is the ribs. So if you are touching in front of your chest, if they say beat your chest, when you are beating your two chests now, for female, that is where the breast is located. So that is the anterior thoracic wall, and that is what we'll be talking about, the muscles located in the anterior thoracic wall today. So, and what they do, they are connecting the upper limb to the what? Trunk. They connect the upper limb to the trunk, and these muscles are located in the anterior thoracic wall. There are four key muscles. If you want to know, there are four key muscles, and I'll be giving you a mnemonic for them. And one important thing here, they contribute to arm movement. So they help us to move the arm on the shoulder joint. They help us to move the arm on the shoulder joint. They also stabilize the scapula, and they also assist in water respiration. So very easy. So now moving straight to the next one. What is the muscles, or what are the muscles instead? I'll be giving you a mnemonic. So when you remember, please pack some snacks. Please pack some snacks. So if somebody say, please, when you are coming, pack some snacks for me. So please pack some snacks. What is please? Pectoralis major. What is pack? Pectoralis minor. What is some? Some is subclavius. And what is snack? Serratus what? Anterior. So these are muscles of the pectoral region. So don't forget, please pack some snacks. Please pack some snacks. So when you remember it, don't forget, these are the muscles of the pectoral region. So we'll be taking it one after the other. So you have to know the origin and the incision and the movement and the nerve. So it is very important, because if these muscles are damaged, what happens? The individual will not be able to carry out any movement on the shoulder joint. So the first one I'll be picking now is the pectoralis what major. The pectoralis major. When you remember, please remember the pectoralis what major. So one thing you have to know about the pectoralis major, you are seeing it on your screen, is the most superficial what muscles. It's covering the rest of the muscle. It's more out more than the every muscle, and it has two heads in the origination. It has a clavicular head and a sternocostal head. It has a clavicular head and a sternocostal head. So very easy. So a clavicular head, because it's coming from the clavicle. And what part of the clavicle? Is coming from the what? Medial to third part of the clavicle. You are seeing it on the screen. Medial to third part of the clavicle, which is the clavicular head. While the sternocostal head is originating from three places here: sternocostal, sternum, and costal. So the sternum is the anterior surface of the sternum, which is from the manumbrum down to the xiphoid process. So it's coming from the anterior surface of the sternum. So also it's coming from the superior cis costal cartilages. Cis is coming from the superior cis costal cartilages, and below is coming from the what? Aponeurosis of the external what? Obliquus muscle. So very easy. So you remember that the pectoralis major has two heads: a clavicular head and a sternocostal head. The clavicular head is coming from the anterior surface of the medial to third of the clavicle, while the sternocostal head is coming from what? The anterior surface of the sternum, superior cis costal cartilages, and aponeurosis of the external what? Oblique muscles. Don't forget. Don't forget. And what is the insertion? And where is it inserting to? It's inserting to the lateral lip of the bicipital groove. So you can also call the bicipital groove intertubercular or sulcus. So we have the bicipital groove. It's two groove, and you have the groove in the middle. So it has the lateral lip and the medial lip. I talked about it in the humerus video. So the bicipital lip, now the pectoralis major is inserting on the lateral lip of the bicipital groove. And don't forget, what is the work? Since it's originating from the center of the thoracic cavity, now it's originating from the center. And one thing you have to know, everybody originating from the center we do medial rotation. So you remember, one, adduction and medial rotation if you are coming from the center. So now the first one is he does adduction and it also does medial rotation, and due to its origination from the clavicle, it does what? Flexion of the what? Arm on the shoulder joint. So it flexes the arm at the shoulder joint due to its origination from the clavicle. And what is the nerve? The nerve supplies what? Lateral and medial pectoral what? Nerve. Lateral and medial pectoral nerve, which is from C5 to about T1. But both of them come from different places. One come from the lateral cord, one is coming from the medial cord. So the next one we're talking about is the P minor. So please pack is the next one. P minor. What is P minor? Pectoralis what? Minor. So one thing you have to know, it is lying under the pectoralis what? Major. It's just underneath it. It's a very small muscle lying underneath it. And one thing you have to know is origination is simple. It comes from the lateral surface of the 3 to 5 rib. Don't forget, lateral surface of the 3 to 5 rib. So it is very small and it's lying under the P major and it's coming from the lateral surface. And where is it even inserting to? It's inserting to the coracoid process. It's inserting to the coracoid process. And what is the work? Very simple also. The work is very simple. It stabilizes the what? Scapula. So it stabilizes the scapula. So it assists in protraction of the scapula by stabilizing it. So when you are moving your scapula inward, so it assists in protraction and it stabilizes the scapula, and also it contributes to respiration. And what is the nerve supply to this region? Because I say the P major is supplied by the medial and lateral pectoral nerve, while this one is only supplied by the medial pectoral nerve. So please pack some. What is the sum now? We'll go from the smallest one, which is the subclavius muscle. Now by the name subclavius, very easy. So what is the subclavius muscle? It's a very small muscle under the what? Clavicle. Very simple. Subclavius muscle. So very easy. And that part underneath the clavicle, also it affords some protection from the underlying what? Neurovascular structure. It affords some minor protection to the underlying neurovascular structure, because the neurovascular structure coming from the head to the trunk, it helps to what? Cover them and prevent them from what? Damage when the clavicle fractures. So it's very important. So now, where is the origin, where is the insertion? Very easy. The origin and insertion is that the origin of this subclavius muscle is originating from the first rib. Are you getting me? It's originating from the first rib and its costal cartilages. The first rib and its costal cartilages. And it is inserting under the clavicle, in the middle 1/3 of the clavicle, under the groove called the subclavius groove. Don't forget it. So number one, it is originating from the first rib and its costal cartilages, and it inserting under the clavicle, in the middle third of the clavicle, in the middle, not the center, between the lateral 1/3 and medial 1/3. Under it you have the subclavian groove. That subclavian groove is where it is attaching to. You see it on your screen. Very easy. And what is the function now? It anchors and depresses the clavicle. It anchors and depresses the clavicle, and also help to stabilize this SC joint. What is SC joint? Sternoclavicular joint. So it anchors and depresses the clavicle, and when it anchors and depresses the clavicle, it helps to stabilize the what? Sternoclavicular what? Joint. And what is the nerve supply here? The nerve supply is the nerve towards subclavius. The nerve toward subclavius. So if you watch my brachial plexus video, you see how I explain the brachial plexus. And from the brachial plexus in the trunk, you have the nerve to subclavius at what? Your C5, C6. Don't forget C5, C6 in the upper trunk. Very easy. So the last but not the least to be talking about is the serratus anterior muscle. The serratus anterior muscle. So now this muscle is also located in the thoracic wall, but the only problem is that it's coming from the lateral side of the thoracic wall. Very easy. The lateral side of the thoracic wall, but it's in thoracic wall, but much more in the lateral aspect. So one thing here we have to know is that where is the origin? Where is the origin? The pectoralis minor is coming from what? The 3 to 5 ribs. The 3 to 5 ribs, like we said. So where is the serratus anterior coming from? It is coming from the lateral aspect of the number 1 to the 8 rib, the first to the 8 rib, lateral aspect of the first to the 8 rib. Very easy. But why the P minor is coming from 3 to 5 rib, number 3 to the number 5th rib? Why this one is coming from the first to the 8th rib? Very easy. So since you also know it now, where is this attaching? It's attaching to the anterior medial border of the scapula. The anterior medial border of the what? Scapula. Very easy. So make sure you get all these things to your brain, the origin, insertion, and everything. So what is the function and what action does it do? Number one, it helps to protract the scapula. So it helps to do or protract the scapula. So when you bring your scapula forward, so it is called the boxing muscle. So we didn't say it, it's called the boxing muscle. So all these muscles that boxers used to do, when boxers are throwing their hands during fighting, what happened? They are protracting their upper limb. They are protracting their upper limb, especially they are protracting the shoulder. So when you bring the scapula inward, what are you doing? You are protracting the scapula, and that is what the serratus anterior is doing, together with the assistant of the word P minor. So P minor assists in protraction also. And also one thing you do, it helps in hyper abduction. That is 180-degree abduction. So it helps you to carry your hand in 180 degree, as if you are waving your hand to Jesus. Maybe they say praise the Lord and you are waving your hand, you are abducting your hand the way you are doing. And who helps you to wave your hand? To Jesus, like waving your hand like this, like you see on your screen. When you wave your hand like that, you are doing hyperadduction. So it helps in protraction, chief muscles for protraction, which is called the boxer's muscle, and helping what? Hyper abduction. So what is the nerve supply? The nerve supply is the long thoracic nerve. The nerve supply is the long thoracic nerve. And one thing you have to know, the long thoracic nerve is coming from where? C5 to about C7 part of the brachial plexus, around the root. So it's originating from the what? Root. So very finished. We are done with everything. So remember, the P minor assists the serratus anterior in protraction, and again the P minor also assists in respiration, while the P major does flexion, adduction, and medial rotation. You know it as FAM, just like family. FAM, flexion, adduction, and medial rotation. While the subclavius help us to what? Anchor and depresses the clavicle. So we have destroyed the muscles of the pectoral region. Very easy. So the first clinical note to be noting is paralysis of the serratus anterior. Now, what causes the paralysis of serratus anterior? It is the damage of the long thoracic nerve. So when you damage the long thoracic nerve, you paralyze the serratus anterior, and this will cause winging of the scapula, where the scapula will move inward to the center of the back. So you see the scapula protruding and moving to the center of the back, which is damage to the long thoracic nerve, which cause weakness and paralysis of the serratus anterior. Again, now when you have weakness of the pectoralis major, so what does pectoralis major help you to do? Medial rotation, as if you are hugging somebody. So when you are damaging your pectoralis major, you will have a difficulty in adduction, which is you'll not be able to hug somebody. Yeah, that is one thing you have to know. Now the next one, when you have weakness of the subclavius, what happens? Because the subclavius protect what? Underlining what? A neurovascular structure coming from the head. So when you damage or cause weakness of that muscle, what happens? Your scapula might fly off. And if your scapula does not fly up, what happens? The neurovascular structures will be damaged. Very easy. So I hope it all made sense to you, and hope you remember the mnemonics. Please pack some snacks. Please pack some snacks. Please for P major, pack for P minor, some for subclavius, and the last one is what? Serratus anterior. And don't forget what they do. We have said everything, and they assist in one arm movement, scapular stabilization, and respiratory support. So that is one thing you have to know. So now keep watching my video. Always like, always share, because the next one I'll be going to muscles of the what shoulder region. That is the next one I'll be going to. So don't forget to continue watching and practice all these muscles, because when you do not practice it, what happens? It cannot stick to your head. Practice it, because in clinical practice you'll be using everything. I'll see you in my next video. Bye.